our lead story tonight on that major security breach. Let's just look now at the exact details of what happened today as the Prime Minister was scheduled to address his first major rally in Punjab after the farm laws have been repealed. So here are the pictures. The Prime Minister lands first in Bathinda and Punjab. Now he's greeted by the Finance Minister Manpreet Badal. The Chief Minister wasn't there. Then he drives. He decided because of bad weather, he drives to his rally venue in Firozpur. It's almost 90 kilometers. At this point, the government is saying that there was not proper security given. So we can see there his car, the Prime Minister sitting in that car, a bulletproof Toyota Fortuner, because there were protesters up ahead. There were blockades, so he couldn't go ahead. You can see there's security detail around him, discussing what to do, as well as Punjab police personnel. But as the government is pointing out, why is it that one, the DGP, the Chief Secretary, who were meant to be with the Prime Minister, the Chief Minister, none of them are present. They're saying this was a planned conspiracy, a murderous conspiracy. The Chief Minister says that because AIDS tested positive, he couldn't be there to receive the Prime Minister. So a murderous conspiracy to harm the Prime Minister, or as the Punjab Congress is saying, did the Prime Minister leave because there were empty seats at that Firozpur rally? Here's the war of words over what is a major security breach. You can see there the Prime Minister of India stuck on a highway for 20 minutes.
The Prime Minister stuck in his car, a bulletproof armored Toyota Fortuner, on a Punjab highway surrounded by his security detail with no clear road available to him for his first major rally in the state after farm laws were repealed, as protesters had blocked the Bathinda-Firozpur highway. An unprecedented security breach in the Prime Minister's security, said the government. This, as news agency ANI reported, the Prime Minister told Bathinda airport officials they should thank their CM that he is leaving Punjab alive.
नरेंद्र मोदी देश के प्रधानमंत्री बने देश के नागरिकों के वोट और आशीर्वाद से। उन्हें ध्वस्त करना है तो इलेक्शन में करते हैं। ये साजिश रचने की क्या जरूरत थी? But today they tried to harm the Prime Minister of India so that Narendra Modi could be brought to harm.
A BJP worker in a car following the Prime Minister tweeted this.
देश के प्रथम प्रधान सेवक प्रधानमंत्री मोदी जी की कार सामने से मैं और वो एक ही रोड पे हैं। कितना बड़ा सिक्योरिटी लैप्स है और वो सामने 10 मिनट खड़ी रहने के बाद यू टर्न लेके वापस आ रही है।
Punjab ministers immediately refuted this, tweeting pictures of empty seats at the PM's planned rally in Firozpur, saying the PM cancelled the rally because of lack of crowds. The Punjab Chief Minister categorically ruled out any security threat to the Prime Minister, saying the Prime Minister had changed his route at the last minute. This, as the BJP President JP Nadda said, Channi had refused to pick up his phone during the hold-up. And the BJP questioned why the CM didn't receive the PM at the airport as per protocol.
कि प्रधानमंत्री हैं वो साडे ਉਹਨਾਂ ਦੀ ਜਾਨ ਨੂੰ ਜੇ ਖਤਰਾ ਹੋਏਗਾ ਤਾਂ मैं अपना खून ਉਹਨਾਂ ਤੋਂ ਪਹਿਲਾਂ ਡੋਲਾਂਗਾ। ये पंजाबियों की फितरत है। ये बिल्कुल गलत है कि प्रधानमंत्री जी जब पंजाब में आए तो उनकी सिक्योरिटी लैप्सेस दिखाकर उनको खतरे के साथ कोई जोड़ा जा रहा है। ये राजनीति इसमें नहीं होनी चाहिए। वी हैव एवरी रिस्पेक्ट फॉर अवर प्राइम मिनिस्टर। ਜਦੋਂ ਕੱਲ ਮੈਂ ਤੇ ਆਪਣੇ ਦਫ਼ਤਰ ਦੇ ਬੰਦਿਆਂ ਦਾ ਜਿਨ੍ਹਾਂ ਨੇ ਮੇਰੇ ਨਾਲ ਜਾਣਾ ਸੀ ਉਹਨਾਂ ਦਾ ਕੋਰੋਨਾ ਟੈਸਟ ਕਰਾਇਆ ਤਾਂ ਮੇਰੇ ਹਰ ਟਾਈਮ ਨਾਲ ਰਹਿਣ ਵਾਲੇ ਹੁਸਨ ਲਾਲ ਜੀ ਜਿਹੜੇ ਕਿ ਸਾਡੇ प्रिंसिपल सेक्रेटरी है वो कोरोना पॉजिटिव आ गए।
आप मुझे ये कह रहे हैं कि कांग्रेस पार्टी ये कह रही है अपनी सरकार के माध्यम से कि उनको ये नहीं पता कि उनके प्रदेश में प्रधानमंत्री जी कहाँ हैं। चलिए, जो फोन पर नहीं आए वो टीवी पे तो आएंगे। फोन पे आ जाते सुरक्षा कर्मियों के लिए शायद प्रेस कॉन्फ्रेंस करने की नौबत नहीं आती।
With the Punjab elections just months away, this is now a major issue. Ex-Chief Minister Amrinder Singh said the government must be dismissed immediately. Even senior Congress leader Sunil Jakhar tweeted this was against Punjabiyat.
Well, that's the big political story, but really the main story we're tracking here on NDTV is what's happening with COVID. And just look at how our cases are escalating. This is India's third wave. driven by the Omicron variant. So as we can see, our cases are up over 6 times in the last 8 days. So on the 29th of December, that's just a week ago today, it was 9,195 cases. Then it rapidly started going up, 13,000, 16,000, 22,000 on the 1st of this year, then 33,000 just 2 days ago. And today we're at 58,097 cases. That's literally 55% in just 24 hours. So let's just look at our latest numbers. We're at 58,097. That's up 55.42%. Our deaths are also up 330%, but the actual deaths which are new are 82. The rest is the backlog from Kerala. The positivity rate also shooting up at 4.18%. Remember, the WHO says above 5% is a major cause for worry. Our vaccinations are, well, relatively constant at 87 lakhs, 27,500. The tests are up 20.3%. Let's just look also at the sharp increase in positivity in 8 states. We now have 28 districts with over 10%. You can see in West Bengal, Maharashtra are the highest with the positivity rates, followed by Delhi. That number's changed now, the latest numbers coming out, followed by Kerala, Tamil Nadu and Gujarat and Karnataka. So the Health Ministry has warned that we must watch out for the increase in these cases. But let's go across to Rishika first, because the government has also announced new home isolation guidelines, given the fact that this is driven by the Omicron variant, where some studies say that the variant people are testing negative earlier. So what are the new home isolation guidelines, Rishika?
Well, let's break it down for our viewers. The Health Ministry has issued new guidelines. If you are an asymptomatic or mild patient who has maintained an oxygen level which is above 93, well, you can isolate at home. The isolation period has also interestingly been reduced from 10 days earlier to now 7 days if you do not have fever for 3 days continuously. No testing is now required after 7 days. So if you're mild or asymptomatic, after 7 days you needn't test negative, but you have to still wear a mask. There is no test required for asymptomatic contacts of a positive patient. So if you've come in contact with someone who's tested positive and if you're asymptomatic, the Health Ministry now says just isolate at home, you needn't get tested. Home isolation cases, however, must ideally have a vaccinated caregiver. Home isolation for immunocompromised patients with comorbidities, those above the age of 60, should only happen under medical advisement. So only if a medical officer advises it, should you actually go ahead and isolate at home. However, interestingly, the Health Ministry has reiterated the use of N95 mask in those who are positive, and that mask in fact should now be discarded after 8 hours. So that's a new guideline that is being issued, and this of course is for COVID positive patients. No sharing of utensils, regular sanitization of common surfaces, and no self-medication. But crucially, let me also bring your attention to when you need to seek medical help. The Health Ministry has clarified that if you have fever, which is more than 100 degrees for a period of 3 days continuously, and it remains unresolved with a paracetamol, a 650 mg, which is a high dosage 4 times a day, you must seek hospital admission. Also, crucially, if you have difficulty in breathing, if your oxygen level dips below 93 for at least 3 readings per hour, you should seek hospitalization. The other symptoms to watch out for closely are persistent chest pain, any kind of mental confusion, very severe fatigue or muscle pain. You should consult your doctor and seek medical help.
Rishika, thanks so much for the very informative details on the new home isolation guidelines. And today also the Health Ministry briefing, where top government doctors have said now a decision has been taken that the 3rd dose, which begins on the 10th of January for those above 60 and who've completed 9 months, and for healthcare workers, will be the same as the original 2 shots of the vaccine they got. So if you've taken Covishield, you'll get Covishield as your 3rd dose. If you've taken Covaxin, you get Covaxin as your 3rd dose.
Senior citizens above 60, healthcare and frontline workers will finally get a booster. But it will be a 1/3 dose of the same vaccine that they have received, not a mix and match as is the global practice.
The precautionary vaccine dose that will be given to healthcare workers, frontline workers and individuals 60 years and above with comorbidities will be the same vaccine as has been given to them previously. Those who have received Covaxin will receive Covaxin. Those who have received the primary 2 doses of Covishield will receive Covishield.
But this decision may change as more data emerges. But the big question remains, When will all eligible adults get a booster, particularly since Omicron is growing exponentially? To this, there is no answer yet. Significantly, the government has cautioned about the use of Molnupiravir, the anti-COVID drug which is being manufactured in India despite getting emergency use authorization.
We have to remember that this drug has major safety concerns. It can cause teratogenicity and what you have mentioned, mutagenicity, and it also can cause cartilage damage and can also be damaging to muscles also. So it is not included in the National Task Force treatment. The WHO has not included it. The UK has not included it as of now.
For now, India's policy on the rollout of boosters remains slow, with lakhs of citizens having received their second dose more than 6 months back. 2 drugs, Corbevax by Biological E and Covovax, have been cleared for use in India, but there is no policy announcement on their use. Even the Covovax, known as Novavax abroad, is being manufactured and exported by the Serum Institute of India. With Meher Pandey, Bureau Report, NDTV.
Well, the Congress today said it would be cancelling all its election rallies and events in poll-bound states after a stampede in a girls' marathon in Uttar Pradesh yesterday. However, the Congress has also written to the Election Commission complaining against rallies by the Prime Minister and Yogi Adityanath at government events. However, there's been controversy over the fact that the Karnataka Congress is planning to go ahead with the Padyatra in the state. When asked, the Karnataka Congress chief said, why is it that the Prime Minister is holding rallies everywhere?
After this near stampede at their event in UP's Bareilly, the Congress has called off all big political rallies in the state for 15 days. The party has also written to the Election Commission asking for big rallies of all political parties to be cancelled and for action against Prime Minister Narendra Modi and Chief Minister Adityanath for using government events in UP to make political statements.
अब भारतीय जनता पार्टी को बताना होगा कि वो क्या करते हैं। उनकी रैलियां तो बदस्तूर जारी हैं। आज प्रधानमंत्री जी पंजाब में हैं।
But mixed messaging from the Congress elsewhere. In Karnataka, party chief D.K. Shivakumar refused to call off a proposed Padyatra this Sunday.
Our party leaderಗಳೆಲ್ಲ ಪ್ರೊಟೆಸ್ಟ್ಗಳು ಮಾಡಿದ್ರು. Our party leaderಗಳೆಲ್ಲ ಏನು ಮೆರವಣಿಗೆ ಮಾಡ್ಕೊಂಡಿದ್ರು. ಕೋವಿಡ್ ರೂಲ್ ಪಾಲನೆ ಮಾಡಿದ. ನಿನ್ನೆ ಪ್ರೈಮ್ ಮಿನಿಸ್ಟರ್ ಇಡೀ ದೊಡ್ಡ ರ್ಯಾಲಿನೇ ಮಾಡಿದ್ದಾರೆ ಪ್ರೈಮ್ ಮಿನಿಸ್ಟರ್.
UP Chief Minister Adityanath cancelled a Thursday event in West UP's Noida. No official reason was given, but the district has seen the biggest surge in COVID cases across UP in the last week. In the next few days, both the Prime Minister and Samajwadi Party Chief Akhilesh Yadav have big events lined up in Uttar Pradesh, one in Lucknow and the other in Ayodhya. Both parties haven't said anything officially on whether there is a rethink about going ahead with both these events. With Shrija MS in Bengaluru and camera person Vineet Verma, this is Alok Pandey, NDTV.
And today, the Uttarakhand High Court has told the Election Commission, consider online voting, consider virtual rallies. In a hearing today, they said that this could be possible alternatives in the future. Virtual voting, of course, will be something which is extremely controversial, but the Uttarakhand High Court reacting to the huge rallies being seen all over the state. And let's look at our cities. Well, Mumbai remains India's COVID capital. In fact, it had its highest ever single day COVID tally today with 15,166 new COVID cases. The last highest daily count for Mumbai was 11,163. That was in April last year. Today, 87% of patients are asymptomatic. 80 out of 1,218 on oxygen support. So there are currently 1,200 patients in hospital and the hospitalization numbers are rising. So we can't be complacent here as Mumbai has its highest ever single day COVID tally. In Delhi as well, nearly 100% jump in daily cases at over 10,665. In Bengaluru also, though the cases are less, a doubling being seen here almost daily. However, the big focus in both these cities and Mumbai as well is the fact that so many healthcare workers are now testing positive, making the fight against the COVID pandemic even harder.
At least 150 healthcare workers have tested positive for COVID. On a day, Delhi reported 10,665 cases, a 94% jump over yesterday. 8 deaths were also reported in the national capital.
केसेस कल 5,500 के आसपास थे और आज 10,000 के आसपास जो शाम तक बुलेटिन है, अभी पॉजिटिविटी 10% के आसपास आनी चाहिए.
Doctors have already sounded an alert for Delhi, saying it is inevitable that hospitalizations will rise.
Number of patients coming for hospitalization is also increasing day by day. If you compare with the second wave, it's even faster than the second wave. Earlier we used to have only 3 to 4 admissions of COVID per day. Yeah. Now we see that around 15 to 20 admissions are coming.
Adding to an already stressed healthcare system, doctors who have tested positive for COVID and other symptomatic healthcare workers who are quarantining and awaiting their test results. For the remaining doctors on shift, it means triple the work and 30-hour-long shifts.
Our work is almost tripled. Actually, our healthcare system is seeing a shortage of doctors, as one entire batch of PG resident doctors haven't joined.
At this private hospital, while an additional floor has been dedicated to COVID cases, nearly 20 healthcare workers are down themselves with COVID.
You see, as a protocol, we have a double door policy which is there. So behind this, we have rooms where the patients are there. We have a pass window, we call it a pass window. So any food item, any other medicine which needs to be passed to those people is through this window. The people keep it from the outside. They knock it there or they inform the people, the staff there on the phone, and they come and collect it, and then this window is closed off. Earlier, if we were getting 2 to 3 patients of the COVID, so now we will be getting 10 to 12 people.
In Bengaluru, cases have shot up drastically, with at least 2,000 cases being reported on an average daily. Last year, Bengaluru, a major health hub, was overwhelmed with cases. This year, healthcare workers are pleading with citizens to be responsible and follow COVID-appropriate behavior.
The numbers is definitely going to be an issue. Numbers is doing, the way we have seen is in the last 2 weeks, or probably I think from yesterday to today it has doubled. We have seen that there is a sudden spike compared to what we are seeing, the number of patients coming to the emergency.
We are staying in a hostel and I'm working here since 1 year. And also,
so you can't even go back?
Yeah, I can't even go back to home. We work double shift, and also we even not getting a time to eat lunch properly also.
Doctors have already sounded an alert. More COVID cases, more hospitalizations. But with hundreds of healthcare workers testing positive, the question is India's healthcare system ready for the worst yet? With Mohammad Mursalin in Delhi, Shunakshi Chakravarti for NDTV.
So it's actually a terrible situation for doctors and healthcare workers. We can see that the numbers, that they're the ones who are being hit the hardest with COVID. They haven't got booster shots yet, even though this is being warned that we should have given booster shots. We had the vaccine to them first, so now they're falling sick. Because they're falling sick, the other doctors and nurses are doing longer shifts. And this also, as a current batch of resident doctors, isn't in there because they haven't had their counselling. This because the case is stuck in court, as has been appealed against the EWS and OBC reservation in the NEET exams. The centre today appealed to the Supreme Court that take a decision on just the counselling. Let the counselling go ahead because we need doctors now, and there's a bona fide request at the centre to resume this counselling, saying that we're in a different situation now. As a society, we can't go into lengthy arguments on reservation at this moment. We need doctors. Justice Chandrachud said, we would like to end this uncertainty. The hearing now will continue tomorrow. Moving to one of our other special reports, this is from Tamil Nadu, where a Sunday lockdown has been announced and also a curfew at night from 10 to 5. This as the numbers, overall numbers aren't that high yet, but again, we're seeing a worrying escalation.
As cases spike in Tamil Nadu, the state has announced curfew between 10 p.m. and 5 a.m. from tomorrow. There will also be a complete lockdown on Sunday. This is the first time such curbs have been announced in the state in the third wave. Chennai is seeing a surge in daily tally from 619 a week ago to 1489 yesterday. It jumped by 69% on Tuesday alone. Govindamal's son, 28-year-old salesman Vignesh, has tested positive. His mother has admitted him to the Rajiv Gandhi Government Medical College Hospital.
Check பண்ணதுல அதான் இருக்குதுன்றாங்க.
Harshit Darbar has just learnt his 15-year-old daughter, Mirlanini, is positive. She is asymptomatic and doctors have advised her to be in home isolation.
ஜுரம் இருந்தது, கஃப் சளிலாம் இருந்தது, செக் பண்ண வந்தோம், பாசிட்டிவ் வந்தது, மருந்து கொடுத்துருக்காங்க, ட்ரீட்மெண்ட் எடுத்துருக்காங்க, ஹோம் குவாரண்டைன் கொடுத்துருக்காங்க. ஆமாம் சார்.
எத்தனை நாளாக இருந்துச்சு அந்த மாதிரி?
3 நாளாக இருக்குது. இந்த மழை வந்தது இப்போ 2 நாள்.
With 121 Omicron cases spread across the state, authorities blame the spike on the new variant as well as violation of COVID protocol.
There is virulence is less and at the same time infectivity is high. Transmissibility is very high.
The government is not taking any chances. 1.3 lakh beds including 8,500 ICU beds already. The Chennai Trade Center, for instance, is being converted into a Corona Care Center with 900 beds. Around 40% of Tamil Nadu's 18-plus eligible population is yet to take the second dose. The state recorded more than 36,000 cases when the second wave peaked in May. With Omicron variant triggering similar fears, the Tamil Nadu government is not taking any chances. In Chennai with Suresh, Sam Daniel, Find It TV.
Well, a quick look at other news. A month after the tragic helicopter crash carrying India's top general, General Rawat, his wife Madhulika Rawat and 12 others, a report into what caused the crash was given to the Defence Minister today. Sources have told NDTV that the main reason was pilot error in bad weather. Sources say that the report says this was a controlled flight into terrain, which means that this was because of an inadvertent error by the pilot. The helicopter did not malfunction. It was operating in cloudy conditions, and the controlled flight into terrain is considered pilot error. Internationally, the International Air Transport Association refers to this as an in-flight collision without indication of loss of control. Sources also said the report has recommended that rules for VVIP flights should now be looked into again.